Dear ENT residents and surgeons, the most common findings, approaches, points, concepts are one of the very highly tested questions in ENT entrance exams, ENT residency exams, VIVA exams in ENT, post-specialization exams like TSA ENT, MRCS ENT, HAD ENT, Prometric ENT, NEET SS, and so on. So they are also equally important for surgeons and consultants to keep themselves updated. Different exam resources give different variations in the most common points and hallmark points and this kind of tested points. So this video will be the end of all the doubts, confusion and controversies in the most common points in ENT, otolaryngology and head neck surgery. You know that Brown and Cummings are tremendously respected textbooks worldwide. What such textbooks mention as the most common points, they are very important. Each word from the video is a potential question for any ENT exam in the world. So take a pen and a paper and note down all these points. So without much delay, here we begin the most commons in ENT from two of the most authentic and respected textbook of ENT, otolaryngology and head neck surgery from the world, that is Scott Brown, 8th edition, Cummings, latest edition, that is the 7th edition of the Cummings. Here we go. The first section will be from the Cummings 7th edition. So point number 1, pars flaccida is the most common location for retraction pockets, debris and cholesteatoma. Page 37, Cummings 7th edition. 2. The most common cause of hypoparathyroidism is iatrogenic from the surgery. Page 46, from Cummings 7th edition. 3. The most common benign neoplasm of pharyngeal mucosal space that lies medial with the parapharyngeal space is mixed salivary tumor. Page 109, from the Cummings. 4. The most common imaging abnormality in the setting of congenital sensorineural hearing loss is an enlarged vestibular aqueduct. So remember, MRCS is the most common isolate in a community acquired deep neck infections in children under 2 years of age. Dental infections are the most common etiology of deep neck infection in adults, whereas Wilder ring infection are the most common in children. So deep neck infection etiology, dental in adults, Wilder rings infection in children. 7. The most common site for the cervicofacial actinomycosis is the vicinity of the angle of the mandible. Cervicofacial actinomycosis, angle of the mandible. 8. The most common parotid lesion in SIB patients is benign lymphoepithelial cyst. The benign lymphoepithelial cyst in SIB patients, they are very responsive to the antiretroviral medications. 9. The most common finding of relapsing polychondritis, bilateral pinaconchondritis or the bilateral auriculochondritis is from the Cummings 7th edition, page 180. 10. The most common complication of septoplasty is persistent in the subjective complaint of nasal obstruction. Nasal bone fractures are the most common fractures of the cranio-maxillofacial skeleton. The most common result reported in linometry is the nasal airway resistance. Linometry, the most common result reported is the nasal airway resistance, the formula for which is the ratio of the pressure flow. Ratio of pressure to the flow. So it is reported in Pascal per cubic centimeter per second. So the most commonly in classic linometry, the values from inspiration they are reported. The values from inspiration they are taken. So that we broke down. The most common site for intracranial penetration of CSF fluid leak associated with face is anterior and medial cribriform plate. Anterior and medial cribriform plate. Anterior and medial cribriform plate, which is formed by the lateral lamella of cribriformis. So there is a most common site for the intracranial penetration or CSF leak associated with face. The most common type of non-allergic rhinitis is idiopathic rhinitis, which is known as vasomuscular rhinitis. So all of you will know with that. 15. Not incorporating the true maxillary sinus osteum into the surgical enterostomy remains the most common cause of failure of maxillary enterostomy. The most common cause of failure of maxillary enterostomy is not incorporating the true maxillary sinus osteum into the surgical enterostomy. 16. Orbital hemorrhage is the most common ophthalmic complication of endoscopic sinus surgery. Osteoma is the most common benign tumor of sinus nasal tract, page 780 from the Cummings latest edition. Glottic closure pattern. Complete closure is the most common pattern for male, whereas postulated gap is the most common closure pattern for female. So glottic closure pattern, they are usually measured in terms of comfortable pitch and loudness. And in a man, the complete closure is the most common pattern, whereas posterior gap is the most common pattern in females. The most common head and neck manifestation of weakness gland by metastasis is glottic stenosis. The most common complications seen with laryngotracheal stenosis is formation of tracheoesophageal fistula for laryngotracheal stenosis complication. The most common cause of laryngotracheal stenosis is prolonged endotracheal intubation. Prolonged endotracheal intubation, most common cause of laryngeal stenosis. The most common site of tongue malignancy, the posterior lateral aspect of the oral tongue. Posterior lateral aspect of the oral tongue is the most common site for tongue malignancy. The maxillary sinus remains the most common site for paranasal sinus malignancy, with an incidence of 50 to 70%. The most common presentation in nasopharyngeal carcinoma is that of palpable neck lump. Free flap reconstruction of soft palate has become the most common method of reconstruction for total palatal defects. Free flap reconstruction of the soft palate for total palatal defects. The forearm flap has become the most common free flap used in oral and pharyngeal reconstruction. Oral and pharyngeal reconstruction, forearm flap, most commonly used free flap. 27. The subglottic hemangioma is the most common laryngeal and upper tracheal neoplasm in newborn and infant. The most common site for laryngeal SCC is the glottic larynx. The most common salivary gland lymphoma is marked lymphoma, mucosal associated lymphoid tissue lymphoma, the most common site of involvement of which is a parotid gland. Marked lymphoma, most common salivary lymphoma, parotid, the most common involvement. The most common used of superselective node dissection, in which the contiguous group of nodes are removed, is the removal of lymph nodes associated with the supraglottic cancer. Supraglottic cancer for superselective node dissection. The most common metastatic tumor to the thyroid is from hypernephroma. 5-1 neurons are the most common neurons of vestibular nuclei. There are 4 types of neuron. Mucosal inflammatory disease is likely to be the most common cause of eustachian tube dysfunction. The empilated limb of the lateral semicircular canal is the most common site for labyrinthine fistula formation. So, empilated limb of the lateral semicircular canal for labyrinthine fistula formation. Cholesteatoma are the most common pathologic lesions of the petrous apex. The most common primary neoplasm of the petrous apex is always chondrosarcoma. Okay, the most common lesion is the petrous apex. Most common primary neoplasm is the chondrosarcoma. The most common area of tympanoplastic failure, very important when preparing for profession, is the anterior superior area. The anterior superior area is the most common area for the tympanoplastic failure while preparing for perforations. Infection is the most common cause of bony ossicular fixation. Infection to bony ossicular fixation. So the isolated fixation of the malleus is the most common manifestation among the bony ossicular fixation. Cholesteatoma is the most common cause of ossicular discontinuity. It's the most common cause of ossicular discontinuity. So you can see the 2 points. For bony ossicular fixation is infection, right? But ossicular discontinuity is cholesteatoma. With complete ossicular discontinuity, the most common audiometric pattern is that of near maximal 55 to 60 dB CHL across all frequencies. Page 2163 from Cummings, the latest edition. 40. The retro tympani is the most common site of cholesteatoma recurrence. Most common site of cholesteatoma recurrence is the retrotympanic space. Otolaryngology is the most common cause of progressive conductive hearing loss in adults. During staphylotomy, the most common piston size is 4.25 millimeters, while a manually crimped piston is used. So remember, manually crimped piston, 4.25 millimeter, heat activated knitting over piston, 4.5 millimeters. Page 2200 of the Cummings latest edition. The most common cause for failure of primary staphylotomy is displaced processes in 53% of the cases. The most common ossicular injury in temporal bone trauma is separation of IS joint. So temporal bone trauma, very important. Most common ossicular injury is the separation of IS joint. The most common type of hearing loss in BOR is mixed hearing loss. The most common presenting feature of acoustic neuroma is progressive unilateral sensorineural hearing loss. Subjective non-pulsatile tinnitus is the most common type of tinnitus. Paragangliomas or glomus tumors are the most common vascular sclerosis tumors of the temporal bone. The most common type of nystagmus seen in vestibular disorder is jerk nystagmus. Vestibular migraine, the most common cause of central vertigo in both adults as well as children. So the last one from the Cummings latest edition, the 7th edition, is local regional vascularized flap is the most reconstructive method for skull-based defect. So this is all about the most common point from the Cummings. So it's not the end of the video. Okay, we have the most common point from the Scott Brown 8th edition as well. So we move on to the 8th edition, volume 1. Point number 52. The most common mutation of the genes in HNSTC, the head and neck squamous cell carcinoma, are P53 and P16 mutation. Okay, the most common mutated genes are P53 and P16. CMB cytomegalovirus is the most common cause of non-hereditary congenital sensorineural hearing loss. The most common pathogens in AFRS, allergic fungal sinusitis, are the Meticulously, which is previously thought to be Aspergillus, but Meticulously species are predominating in the recent edition of Scott Brown, page number 212, volume 1. You can check it out. The species are Corvaria, Biporaris, Alternaria. 55. The most common cause of failure in minimally invasive parathyroidectomy is the presence of multi-gland disease. The cellular type is the most common type of sphenoid pneumatization. The frontal sinus is the most common sinus associated with the intracranial infection. The most common fungi implicated in the chronic invasive fungal sinusitis is the Aspergillus fumigatus. Chronic invasive fungal sinusitis is the Aspergillus fumigatus. 59. Subdural lymphedema is the most common intracranial complication of sinusitis. So subdural lymphedema is the most common intracranial complication of sinusitis. Organ is the most commonly involved sinus is the frontal sinus. Okay, the most common cause of subdural lymphedema is the frontal sinusitis. Trauma is the most common cause of septal perforation. Traumatic optic neuropathy is the most common indication for endoscopic orbital nerve decompression. So traumatic optic neuropathy. The most common indication for the transcription approach is for olfactory meningioma. The transcription approach for skull-based surgery. The most common indication is olfactory meningioma and sinonasal malignancy with skull-based involvement. So quickly we move on to the volume 2 of the Scott Brown 8th edition. The most common points. 64. The most common operative complication of the ventilation tube insertion is displacement of PT tube, that is ventilation tube into the middle layers. The most common structural complication after ventilation tube surgery is Laryngeal sclerosis. Streptococcus pneumoniae is the most common bacteria isolated from the middle layer in acute otitis media. The two most common techniques for choanal atresia repair are transnasal and transpalatal approaches. 68. The most common finding in congenital tracheal stenosis is segment of complete tracheal cartilaginous rings. So, the segment of complete tracheal cartilaginous rings, because the trachea is an incomplete ring. Okay, so the complete tracheal cartilaginous ring is seen in congenital tracheal stenosis, which is the most common finding, as well as the airway lumen is narrowed as, let's say, as 2 millimeters. So this is the very important point. Enlarged lymph nodes are the most common cause of lateral neck swellings. The most common cause for lateral neck swellings are the enlarged lymph nodes. The dissection technique is the most common method of cold steel tonsillectomy. The most common patterns of supraglottic compromise are arytenoid prolapse and epiglottic petiole prolapse. The most common defect, constituting nearly 50% of all non-syndromic hearing loss, is mutation in connexin 26, which codes for the gap junction protein beta 2. Type 2 clinical cleft cysts are most common among the 4 types. The most common complication of submandibular duct transfer surgery is ranula formation due to obstruction of drainage from sublingual branch. Esophageal bronchus, where the bronchus takes its origin from the esophagus, is the most common congenital bronchopulmonary foregut malformation. Okay, the most common congenital bronchopulmonary foregut malformation is esophageal bronchus, in which the bronchus takes its origin from the esophagus. 76. The most common ossicular chain defect in chronic middle ear pathology is erosion of lung process of incus. Similarly, middle ear barotrauma is the most common complication of hyperbaric oxygen. Longitudinal fractures are by far the most common, accounting for up to 90% of the temporal bone fractures. These fractures are more commonly associated with the conductive hearing loss, which may be due to tympanic membrane involvement, hemotympanic or ossicular chain. Is often similar to sensorineural hearing loss in transverse fractures. Okay. 79. The glomus tympanic comparer gangliomas are the most common middle ear tumor. The glomus jugular tumors have the most common regions to arise in the jugular foramen. So, glomus jugulare for the jugular foramen, glomus tympanicum for the middle ear. Paragangliomas are the most common lesions in the jugular foramen, after which they are meningioma and schwannoma. Geniculate ganglion is the most common site of temporal bone hemangioma. So, temporal bone hemangioma, the most common site is geniculate ganglia. Okay, editor, the benign hemifacial spasm is most common in elderly hypertensive females. Elderly hypertensive females. Bilateral concurrent facial nerve palsy is most commonly associated with GPS, or the Guillain-Barré syndrome. The most common site of injury during middle ear or mastoid surgery is the distal tympanic segment, including the second gene. The most common otologic manifestation of sarcoidosis is facial nerve palsy. The most common type of primary cancer in the extraocular canal is squamous cell carcinoma. CSF leak is the most common complication after vestibular schwannoma surgery. Okay, CSF leak, most common complication after vestibular schwannoma surgery. So, the volume 3 of Scott Brown latest of the 8th edition, the most common points. Okay, each word is a potential question for all the international exams in ENT. 88. The most common site of chondrosarcoma in the head and neck is the larynx. Okay, the most common site for the chondrosarcoma in the head and neck region is the larynx, of which the most common site is the posterior lamina of the cricoid cartilage. The most common site in the larynx of chondrosarcoma of larynx is the posterior lamina of cricoid cartilage. TP53 gene, the most common mutated gene in head and neck cancer. PS62 of Otolaryngology. Medullary sinus tumors are the most common among sinus malignancy, contributing to 55%. Head cystic carcinoma is the most common malignant tumor of sublingual gland. The palate is the most common site for minor salivary gland tumors. Salivary gland tumors are the most common neoplasms of parapharyngeal space, the majority of which are pleomorphic adenoma of the deep lobe of parotid. The most common metastasis to parapharyngeal space is from nasopharyngeal cancer. The vagus nerve is the most common nerve to be injured in transoral robotic surgery, TORS. Laryngeal carcinoma is the most common site of malignancy in the head and neck worldwide. So most common malignancy of the head and neck region is the laryngeal carcinoma worldwide. Point number 97. Radicular cysts are the most common cysts of the jaw. 98. Undifferentiated non-keratinizing nasopharyngeal carcinoma is the most common subtype of nasopharyngeal carcinoma. Very important. Undifferentiated non-keratinizing type is the most common subtype. Profound cholesteatoma is the most common short as well as long-term adverse effect of non-surgical treatment of cancers of head and neck region. Non-surgical treatment like chemotherapy, radiotherapy, profound cholesteatoma is the most common short and the long-term adverse event. The most common surgical approach for drooling is submandibular duct relocation. Most commonly used surgical approach for drooling is the submandibular duct relocation, because which are the most common disorder of the minor salivary glands. The lateral aspect of the lower lip is the most common site of recurrence for the mucosis. Lateral aspect of lower lip for mucosal recurrence. Overcorrection is the most common complication of the pinaplasty. Hematoma formation is the most common complication of facelift surgery. Hematoma formation. Remember, the most common application for jejunum. Okay, the most common application for jejunum is the total laryngopharyngectomy defect. The most common application with jejunum is the total laryngopharyngectomy defect. So, these are all about the point. Thank you for watching. Please subscribe the channel to get more of the such videos. And we have uploaded different other videos in our channel like hallmarks in ENT, gold standard ENT. All of them are from the latest edition of Brown and Cummings. And from those videos as well, each word is a potential question for any ENT exams, be it for postgraduate level, undergraduate level, residency, post-specialization exams like DHA ENT, MRCS ENT, HAD ENT, European ENT ORL board examinations, DNB ENT, NEET SS ENT, and so on. Lastly, please show us the support in the comment section if you like our videos. Take care. Bye-bye.